Well, I'm P Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Well, the transplant results are constantly improving. Today, we are talking of 1 year survival of anything between 90 to 95% and 5-year survival in the range of 75%. There are still certain unconquered issues. The problems of infection, of rejection, of ongoing graft atherosclerosis are issues which obviously are very important. Even management of an identification of graft rejection is important. And in a country like India, where the education levels may not be as good and our surveillance programs may not be as great because we don't have that wide reach of domiciliary care and reaching out to our patients. Now those elements also become of prime importance of follow-up of these patients.